In our top story this hour, the Commission for Gender Equality says at least 48 women have been forcefully sterilised at public health facilities in KwaZulu-Natal and Gauteng. The Commission says this is a gross violation of human rights as well as sexual and reproductive rights. The Commission released a report on forced sterilisation of women living with HIV in KwaZulu-Natal and Gauteng. One woman alleges that she was forced to be sterilised because nurses had told her that she had too many children. Another one was sterilised because she was living with TB and could infect her unborn child. All right, and for more now on this report, we have in studio now the Commission's chairperson, Tamara Mathebula. Good afternoon. Thank you so much for coming through.
Good afternoon, and thank you for having me, Palisa.
All right, so what a report. So this report is as a result of complaints received from Hair Rights Initiative as well as the International Community of Women Living with HIV. Talk to us about the nature of the complaints that you had received as a commission.
Thank you very much. The Commission for Gender Equality actually decided to start a systemic investigation into the reports that we received from these two civil society organizations, Hair Rights Initiative as well as the International Community of Women with HIV. What was brought to us basically was just several complaints from KwaZulu-Natal as well as Gauteng province hospitals where women were sterilised without knowing that they were undergoing this serious medical procedure. What was told to them was that they were just taken in for cesarean section. That's why they were sent to theatre for a difficult labour or delivery.
So they were all misled into being
all
sterilised.
Of them
okay,
were
we're going to get
misled,
to the
yes.
nature of those allegations, but you say that the complaints were they specifically from the two provinces, and one wonders if this could be a national practice or a national phenomena.
I must say that, you know, the two provinces and the 15 hospitals that we went to were actually our sample. We sampled them, but we obviously know that given the nature of these complaints, definitely this practice is still happening in a number of hospitals in South Africa, so in all 9 provinces. So this is going to be one of our recommendations when we meet the Department of Health nationally to say, can we further investigate into all 9 provinces and see what is happening in other hospitals around the country.
All right, so this report itself could not be completed in time due to a number of limitations really that were beyond the Commission's control. And amongst those, Mathebula, is the reluctance from women to lay complaints with the Commission. Does this not speak to perhaps the lack of education and the lack of knowing their rights on this particular issue?
You're quite right, absolutely. I think a lot of women out there still don't know a lot about their rights, let alone the sexual and reproductive rights that they have. The rights to say no, the right to complain, the right to sign a consent form that actually talks to your reproduction in general, and the right to, you know, technologies that are beginning to talk about contraception, and we cannot see sterilisation as the only way of contraception, especially when it comes to women living with HIV, as well as poor women who have more children, as well as in cases of TB, to say you cannot actually reproduce because you have TB and we are afraid that you will pass the TB to the child, to the unborn baby.
So what has the response been from the department, or rather, let's just talk about your experiences and the attitude that you may have picked from the department during your consultations whilst you were busy with this investigation?
I must say that the consultations were done in 2 provinces, KwaZulu-Natal obviously, Department of Health in KwaZulu-Natal and Gauteng. In these 2 departments, what we received actually was that they were more than willing to give us more information. But when we went into those 15 hospitals in these 2 provinces, we discovered that some of the information was then removed from the files, so which then started, the whole notion of querying the filing system for the government departments to say, if we cannot find files as well as those consent forms for verification, then it means this is serious. As well, we did not get the actual names of the doctors and the nurses who actually performed this kind of a procedure, but also we did not find the names of the nurses and doctors who advised otherwise.
Which may be very important, because I suppose that the code of ethics for these health practitioners talks about the value to human life as well as respect and perhaps dignity. So are we ever going to get to a point where those who are responsible for all these deeds get to account?
I fully agree with you that there is a legal as well as ethical considerations here. What we have done is that as we launch the report today, we are going to have a formal meeting with the Minister of Health. We are also going to have a formal meeting and an engagement on the report with the HPCA, which is the health professionals body that is responsible for the doctors, as well as the nursing council that is responsible for the nurses, so that we can table the findings of our reports and they can then further do the investigations in the next 3 months in terms of looking at who was on duty on that day, who actually made a patient or client sign the consent form, if they were at the labor ward on that day, and there is going to be further investigations that will be done by these statutory bodies. And we are saying that following those reports, we need to make sure that there is consequent management and people are followed ethically and legally, because the process was not followed.
Which leads me to my next question as to what happens going forward. Are you just going to have those recommendations and findings on a piece of paper? Do you have sharp teeth to bite as the Commission for Gender Equality? Because I read the report earlier this morning, the horrific stories that those women had to go through. One was told that you've got too many babies, so we're going to sterilize you, and that happened without her consent. So what powers do you have as the Commission to really make sure that something happens? It's not just a report, another report on a piece of paper.
Thank you, Palisa. I must say that we do draw our powers from the Constitution, Section 187 of the Constitution, and we also get our powers from the Commission for Gender Equality Act number 11, A and E, subsection 1, where we actually say that our recommendations are binding, first of all, and people need to take our recommendations very seriously. So we do have teeth to bite, because if we offer or issue recommendations and people don't follow, we do follow-ups, and again we draw our recommendations to actually take the matter further. So consequences definitely will be there if the Department of Health, HPCSA, as well as South African Nursing Council don't follow through on those recommendations. There will definitely be consequences.
But the Commission is also seeking some redress for the victims?
We are also seeking some redress for the victims. We are also lodging our own a complaint and filing to the Law Reform Commission, so that this matter can actually be settled once and for all.
All right, time constraints, we have to leave it at this, but thank you so much for coming through. Always pleasure speaking to you.
Thank you very much.
All right, well, there you have it. Tamara Mathebula is the Commission for Gender Equality's chairperson, talking to us about this report. So as I said earlier, we are also scheduled to speak to the Department of Health to give them that chance to respond to the report and really to hear how they're planning to take this matter